Good morning, everyone. Welcome to the GSL platform. In today's show, we have the guest Dr. Sanjay Oak. Welcome to the platform, sir. It's a huge privilege to have you here. So, my first question to you is that so you have excelled working in operating room. You're a writer. You're an activist. So, how do you juggle between so many roles, and how do you push yourself to work on such a different aspects in today's world?
Basically, I'm a surgeon. I'm a
Yes.
hardcore surgeon.
Okay, sir.
So I operate small children every morning.
Yes.
This is something that is my life and which I have lived for last about 35, 40 years. So when you are working in hospitals, you do tend to pick up the small nuances of the needs and the basics which need to be done for the betterment of people and patients. And that shifts your focus to the hospital administration. So that's what happened to me. And therefore, I wear then the second hat as an hospital administrator. You get a lot of experiences in life, and hospital is a repository of such emotional turbulences. So I picked up those nuclei and then I wrote around it, and that's how several articles were generated. Sometimes scientific, sometimes emotional, family background related to the patients, and anecdotes that kept on happening. And that's how the paper article series is, and then the books followed. I was intrigued by laparoscopic surgery in children, and I was probably the first who set up a teaching department in laparoscopy in India. So then I wrote textbooks on laparoscopy in pediatric surgery, and that's how I have continued till today. So it's all interwoven, I would say.
With advancements in technology, with simulation technology evolving constantly, what do you see the upcoming trend that you foresee for the next decade, sir? And how is it gonna impact the medical education in the coming years?
We have to embrace and welcome the technology, but we cannot let go humanity. So, actually, there are three things which are required: lectures by senior experienced professors, that's one; technology in a simulation lab that will prime you, prepare you for better quality ward work, and three is the actual ward work. A simulation laboratory is never a substitute, but it's a supplement to good clinical work. And the future medical education will happen on the basis of these three areas. There will be also telecommunications. So I sitting in Mumbai can teach or can train or can proctor someone miles away using a telesimulation. This seems to be the future. And the VR and AR, these are going to add, they will never replace the realities, but virtual reality will augment the experiences of the actual reality.
What advice would you give to a 21-year-old medical student who has joined the MBBS recently?
Never look at money, point number one.
Okay.
Go on working, money will follow you. Do not refuse a patient because he is poor or he is from a downtrodden lot of the society. You will really learn the nuances of medicine from poor patients. They are doing you a favor by coming to you. And whatever you do with your heart and soul in it. Don't do it mechanically. Never look at watch. Never take leaves. You must work, and work will make you a perfect good doctor.
So, with numerous publications and book chapters, what's the one piece of work that you're most proud of and its impact on the health sector, sir?
I did when I was an administrator, when I was a director of the city of Mumbai and director of KEM Hospital. Apart from all the scientific and technological advances, we did a lot of things of giving good meal, of giving chapatis to poor patients, which was not being done for several years together. So there are several things which I did which touch the heart, touch the betterment of a common man in the street. And that is what gives me maximum pleasure.
So, what's the upcoming research areas that can be done in the pediatric surgery, sir?
In pediatric surgery, the things will move towards early repairs. good amount of rehabilitation, long-term rehab in the society, in the schools, and they becoming more and more productive. Some technological advances for neurologically impaired, and these things seem to be the advances, and obviously the genetics treatment will come in the book.
So, what kind of simulation technologies can be created and brought into learning the pediatric surgery, sir? What are the trends that we can observe?
Yeah, simple things such as intubation,
Okay.
because that saves the life of a child, tracheostomies, endoscopies, use of staplers, and the whole gamut of laparoscopic pediatric surgery, the hernia repairs, the gallbladders, the pull through procedures, extirpation of malignant tumors, all these things can be done with the simulation, and the next step would be the robotics.
Thank you, sir.